of Reform UK. Richard Tice, welcome to you. I mean, on that last point there, that we've had 2 years when the cash spigot, I'm never quite sure what the word is, but you know what I mean, the cash taps, money from you and I, from taxpayers, there's been no limit on it. And part of the insatiable appetite of the public sector has been within the NHS, how to curb it.
Well, it's unbelievable, Colin. Good afternoon, because the budget, they've admitted, has increased or is increasing between pre-COVID at about 27% of all public sector spending to about 44%. That's over a 60% increase in 4 years in healthcare spending, Colin. And yet, actually, what the government's now doing is saying, by the way, despite that increase in spending, waiting lists are going to double. And it's going to be a very long time before they come down. Oh, and by the way, we've actually basically given up understanding how we can make you healthier. So could you make yourselves healthier? Because we don't know how to, and we don't know how to get the waiting list down. I mean, this is completely out of control, Colin. I mean, it's staggering. It feels to me. There is some good news, though, in that the Tories they're beginning to start to adopt the key plank of the reform healthcare policy, which is putting the patient in charge. We believe that the patient should be able to determine how quickly you get seen by a hospital, by a consultant or a GP. And there's a small sign here, because what the health sector has announced is if you've been on a waiting list for 2 years, Colin, when most Western nations don't have a waiting list, if you've been on a waiting list for 2 years, then you'll be lucky enough that you might be able to go to a hospital a little bit further away, and you can choose and seek out an appointment that's a bit quicker. Our plan is completely different, much more constructive. If you can't see a GP in 3 days, you get a voucher. You can go private. Still free at the point of delivery. Still free at the point of delivery. If you can't see a consultant in 3 weeks, you get a voucher. You go private. Still free at the point of delivery. And likewise, if you can't get an operation in 9 weeks. The difference, Colin, is the non-NHS healthcare system will mushroom in size, capacity will grow, waiting lists will tumble. That's the difference.